Hi, my name's Jackie McKenna. I'm one of the primary care sports medicine fellows here at UofSC Prisma Health. I'm originally from Long Island, New York. It's where I grew up, and I was really drawn to this program because of the broad exposure that we get to the field of sports medicine, whether that's on the field, in the primary care, orthopedic, sports medicine clinics, or on campus. We just have so many different opportunities here, so many different people to learn from.
I'm Christina Risk. I'm one of the primary care sports medicine fellows here at Prisma Health and University of South Carolina. I'm originally from Apex, North Carolina, which is a small town outside of Raleigh. What drew me here was that it was in the Southeast, which is an environment I was pretty comfortable with and knew I wanted to stay in. And then it also offered a lot of opportunities from SEC sports coverage to teaching to different ultrasound skills, all of which things I knew I wanted out of a sports medicine program.
Our role through the fellowship program, we wear a lot of hats while we're here, so we spend quite a bit of time on campus covering various UofSC athletic events, spending time in student health. During the day, we're in the clinic where we're either working with the Prisma Health orthopedic teams, that's both primary care sports medicine and the orthopedic surgeons, as well as some time at the family medicine center where we're doing primary care.
We've done a lot of game coverage. You kind of jump in pretty early in the fall, especially because football season's picking up and you've got both USC Gamecock football plus your own high school football plus other fall sports that you're covering. But in that time, we're also working with our primary care attending, seeing musculoskeletal injuries, doing some ultrasound guided procedures. And then as the year goes on, we get more and more independent with those. We get to do more and more different procedures. And then probably the next few months kind of honing in on our ultrasound and procedure skills and making sure we can accurately diagnose and treat common musculoskeletal complaints so we can do those in our practices going forward.
I'm Zoe Foster. I'm the program director here for the Primary Care Sports Medicine Fellowship at Prisma Health Midlands. Our fellows are intimately involved with all of our varsity athletic teams here. They provide home coverage for our football team, home coverage for both men's and women's soccer, as well as our baseball team in the spring. Our fellows have the opportunity to provide home and away coverage for our men's and women's basketball team. It gives them the opportunity and the autonomy to learn how to make their own decisions on the sidelines. They get to work one-on-one with our team's athletic trainer, and it really gives them the opportunity to get to know not only the athletic trainer, but the team that they help take care of. I think in addition to our sideline coverage, another key experiences for our fellows are the opportunity to do some teaching. So our fellows are involved with teaching medical students. We have medical students who rotate with us as part of their sports medicine elective. We are also responsible for the MSK rotations that our family medicine residents do as part of their time here at Prisma Health. Our fellows also have the opportunity to work with athletic training students at all levels of their education.
I think the exposure that we get at a Division I setting and how we are truly integrated into the team is something that's very unique. Christina and I are the first call when something goes on. We're triaging phone calls from the athletic trainers and really have the opportunity to make the first plan of management. And I felt like here I could get that autonomy that's needed in order to feel ready for independent practice within 12 short months. And I also felt like there was a very positive learning environment in terms of the mentorship, the teachers.
Things I've learned so far in the program that will help me in the future, all the physical exam skills that we learn here, all the different injections that we learn so we can treat them, hopefully save them from having to go to a surgery but still get them back to functioning. And also just how to talk to patients and talk to them at whatever level of exercise they're at, from like the novices to like the advanced athletes, just getting those little nuances to get them to trust you so they trust that you're doing the best you can to take care of them.
I think one of the strengths of our fellowship is we have wonderful relationships with people in many different departments at Prisma Health and at the University of South Carolina. Our fellows do spend at least several half days per week with our orthopedists and with our primary care sports medicine folks who work in the orthopedic department. We also have great relationships at the University of South Carolina. We're here today at Student Health, and our fellows spend 2 half days here every week as part of their primary care sports medicine clinic, taking care of the general student body for any sports medicine concern and taking care of our student athletes for any concern. So we truly get to see the full breadth of illnesses and injuries. What I think is exciting is our fellows feel prepared to go on to practice in any of multiple settings, and what we hear back from them is universally positive about their education here.